Welcome to Legacy Sips and Tips podcast with your geeky host, Lindsay Wheeler, where we talk about everything from death, preparing for your future through estate planning, life, the occasional breakup, entrepreneurship, general nerdery, and of course travel, snowboard, and always wine. This is part 5. We're still here.
We're still here. We're out of wine.
We're out of wine. We're never out of wine. With Molly Wilder talking more about death, care, medical issues, all the fun stuff, powers of attorney. So I hope you guys have enjoyed this series as much as I have.
Yes, get your plans done, please. My gosh.
But yeah, it's like, you know, we play soccer and we are on the booze league, and so we go and I basically would say we have some forced exercise so then we can have our drinks, you know, because moderation again, balance. You know, we get some balance. And then your stories from work, and so Bridget's dad is a criminal defense attorney. Yeah. So those stories, her mother was a judge. Oh, wow. She did family law.
Yeah.
And then she is a doctor. So the family dinner conversations were epic. Mm-hmm. And in fact, they are, you know, when she got married with her family, with her husband's family, they were not allowed to talk shop at work at dinner, because it's just, you know, but for your guys' family, it's a little bit different. Yeah. And then like, for soccer, like, you know, I would, even if I'm not playing on your team, we, you know, of course I'll gravitate together and we like just hear the stories of like, you know, the thunder ones or whatever, you know, the thunder sticks or whatever for the one guy who had his surgery. And is he okay? Is he okay? Yes. You know, like just super funny stories. And like mine are a little bit more like, you know, working in criminal stuff. Like it's a little bit more like gruesome, but yours are like, people hopefully survive, or they're very touching, or people have experienced these things. You know what I mean? Like you're a very good storyteller that way, which I always think was interesting. I was like, I need to have you on because your stories are going to be great. And as we're, you know, many hours later, I mean, I'm going to talk all day long. Also, we have wine, so we will continue to talk all day long. But yeah, I mean, like your stories, like I would just be like, all of us would just be like, this is fucking great, man. Right. This is like live theater.
For me, being able to talk about work is whether I'm speaking with other nurses. I mean, it's always being able to bounce stuff off of other nurses that like, oh, let me tell you this story. Oh, let me tell you this story. And we're not there to, you know, one up the other. A lot of it is therapeutic. I'm like, I need to know that like feeling this way in this situation, please tell me that I'm not fucking crazy.
Right. Or I did the right thing.
Yeah.
Or, you know, I feel validated feeling the way I do.
Yes.
You know,
or why I am the way that I am. I mean, our father kind of built both me and my sister to be very strong, outspoken, independent women. Yeah. And a lot of times that gets perceived as we have zero emotion, that we don't have souls or hearts. Like I said, I'm like, I'm just being, why is it just being? But at the same time, those types of personalities can really do justice in a specific situation. Again, a lot of my friends look at it as humor, where they're just like, oh, you know, send Molly in, she's going to be a bitch. This guy's being a dick. Send her over there, because I'm like, that's cute. Hold my beer.
Right.
But at the same time, somebody needs to be able to handle that situation.
For sure, and that's where it's like a very interesting thing. Like especially with ADHD, like we thrive in crisis, and we're really good. And like, you know, I remember my friend and I, we were going to dinner, as we do, because we're foodies, and there was literally a car accident in front of us, and like it was like, she's a little bit more delicate with things. And so I was like, you call 911, I will come over here. And I assess the situation. I got her out and I'm like talking to her and I got her calm. And in fact, one of the first responders who got there, who was a fire chief, which still to this day pisses me off, fired her back up and got her upset. I'm like, I had her calm.
I just fixed this.
You know, and it was like, does that situation, and people are standing around doing anything. I'm like, you gotta act. But that's like you said, like, especially with my 92-year-old, they're like, she knew that I handled business. Yeah. And that's where it's like, bring the asshole in. The asshole needs to come. And there is a time and place for us to do that. There is a time and place for the Care Bear girls. You know, we like those people. We like people with emotions who are sensitive.
You gotta have one on every shift. You gotta have one of those people that are the touchy-feelies that will, you know, bring sunshines and rainbows, while the rest of us in the background
are
getting shit taken care of. And I've always kind of been that person where I'm just like, I mean, I feel for people, but that's not what I'm there for. Right. You know what I mean? And so I'm like, if I wanted to be that, I'd be like a nanny or a teacher or something like that. Or social worker. And I'm not saying that those people jobs are lesser. They're just, it's different. And so I'm like, and especially in critical care, it's like, you gotta get shit taken care of, or else this patient is going to die. Right. And so again, if I can distract, you know, the family member that's getting a little crazy with my Care Bear friend, while I am taking care of the patient, or we've started CPR, or we've done all these other things,
we're moving into action role.
We're doing what needs to be done. I'm very task oriented and kind of emotionally aside. Like I push all that other shit aside.
And it's interesting in those kind of situations. Like you think of people who work in fire, like your brother and your dad. You know, people who work in the ERs and all these things. Like we see horrible shit, like horrible stuff. You guys deal with like real live action stuff. I've dealt with criminal stuff, which is a lot different for me. Like that's more puzzle piecing for me in that sense. Or like my job currently where we do estate planning and dealing with people confronting their mortality is very difficult for people, or having that difficult conversation of being like, it is too late for you to get this in place. Like we have to do that. And so having those roles are very important, because we all need to have those roles. You know what I mean? And I don't think people understand how important that is, and how getting people to do that or understand that I'm not trying to be a bitch to you. I'm just really trying to help you and take care of your business. And it does take a huge amount of toll on people. Like it is a lot. It is a lot of burden. And because you may think that we're very sterile or clinical, we have compartmentalized that emotion, and we have learned to put it over here in this pocket. Like I have
I'll
not
deal
dealt
with that in 4 days probably.
Yeah. Or sometimes not even this point. Like my 19-year-old, that has been completely compartmentalized, and that is over here, and we are not going to deal with that yet. Like I was organizing the garage and found some of her stuff, and I was like, nope. We are not handling that right now. You know. Yeah. And we help facilitate that for other people by putting that aside for ourselves sometimes. And that's where, we have some issues and we need therapy, and we need to bounce things off of people, or have therapeutic conversations, or find laughter in it, because it is a horrible thing to happen, you know, that you're dealing with.
And I think when it's something like, if you know that you're not well, right? You've got a chronic condition, you've got cancer or something like that, and you need to talk about it. Just the feeling of relief of literally getting it off your shoulders, having that conversation, having somebody else not necessarily always say it's going to be okay, because there are moments that I'm going to say this isn't going to be okay, and there's no happy ending to the situation, right? But let's talk through it. Always being able to talk through stuff makes me feel better. Right. I mean, I may cry through it, I may scream through it, I may yell at it, I might throw some shit, I might kick some shit. I was just like, but I'll feel better about it.
Right. Yeah. Because I process through those emotions instead of bottling it up. Yeah.
Yes. And so, and I feel the same way with patients too, when it's like, you will feel better. It's gonna suck in the moment that you're having the conversation, or like you mentioned, taking on the concept of what's going to happen after you die, or while you're dying, that it's never a happy conversation. But I think once you kind of put it out into the open, and you have somebody say like, I'm here for you, I'm going to help you get through this, I will be your power of attorney, I will make the decisions that you want us to make, like, I'm here for you. Makes you feel so good.
Right. That, whether that's a healthcare professional, whether that's your
a sister,
legal
a
professional, or somebody who's in your life, whatever it is, those people are there for those roles, and to like give that away, or give that, you know, and that's like with our friend, where I think because I said no and kind of took the decision away from her in a weird way, like she felt better being okay with it. Yeah. Like, well, I'm not doing this. She's made me do it. Okay, I can, put that aside. And then I think the nurse felt better, where the nurse is like, oh, thank God, somebody's like,
because we see where we're like, girl, it's okay for you to say, I don't want anyone else to come in to visit. I need to rest. Like, feel free to advocate for yourself and say no. And a lot of times in these situations, we get patients that are like, I don't want my family in here. I don't want them to see me like this. I don't want this to be the last thought or vision of me. And some people, and we've seen families that are like, we want to be here when you make the decision to go comfort care, but we don't want to be at the bedside when she dies. Like, I don't want that last image of her taking her last breath to be what I think of. Right. And totally understandable. Totally understandable. Focus on what people, how you remember them.
Because, you don't want to die alone.
But then if the patient's with it, I'm like, you don't want to be there when they take their last breath. Or they'll pick certain people, like, the spouses are usually pretty good about sticking at the bedside. Children are not.
Fair. And that's fair. Yeah.
Children are not. They're like, I don't want to see my mom like that, or my dad like that, and have that last memory.
And sometimes, like I tell people, this is going to be oftentimes a journey you take by yourself.
Yeah. And however you process that. Yeah. Yes. And it is hard, but I think even having a nurse or a doctor tell you that this is normal, this is what we see a lot of, that sort of thing, you can be like, okay, like this isn't anything new. these guys have seen it
right.
a time and time again,
yeah.
you know, and they're here to help us with that. And most people, I would say at least like 80% of people are very open to those ideas.
Yeah.
We get some people that just go batshit crazy. We had a guy that he knew that his dad was passing and he went and got shit-faced. Both on drugs and alcohol, and then came back to the hospital. He couldn't even fucking stand up. And I'm like sitting in the room, like half watching his dad and half looking at him. And I'm like, are you okay?
Yeah.
You know? And I'm like, do I need to tend to you at this point? You know? And so I'm like, now you're really making shit hard for me. Right. Is that like, I'm trying to take care of your dad and you're like over here losing your fucking marbles. And then as soon as we declared that he had passed, like he started throwing stuff, you know, like we had to call security just to get this guy who it was obvious could not be in control of his emotions, plus under the influence of some things, you know, made my life a living hell in that moment while I was trying to take care of his dad.
There's that series of grief, right? Like on The Simpsons where Homer goes through all of them in about 10 seconds or whatever. It's pretty funny. Like there's like bargaining, there's anger, there's acceptance, there's denial. Like it's like a huge process. That's why they have the stages, and you'll probably rotate through those stages
multiple times.
Yeah. And I don't think people either talk about it, understand it, or open to it. And so having people like this talk about it or have people understanding and have that education out there is really important because, again, it's the one guarantee we're going to have in life. So prepare for it, be understanding of it, have that education of it.
And have a plan.
And have a plan, have that estate plan in place, have the powers of attorney, have a death plan, have a death coach, whatever it is, you know.
Yeah, I mean, it's like, you know, women who are having children, right? They're having babies. They have a birth plan of like what they want. Doesn't always mean it's going to go that way. Like, oh, I want a natural birth. I don't want any pain medicine. And then in the moment they're like, give it to me. Right, You know, I can't, give me the epidural, you know. And so things change in the moment based off of how things are progressing, but where I'm going with that is that you set up a plan so that, again, we're meeting the needs that you want us to meet, and until either we can't or we need to make some changes or, you know, something along those lines. Most often they're with it. Right. Not so much on the dying aspect, but yeah.
Yeah, it's an interesting thing that doesn't happen.
My parents have always been very open about things. We had death in the family. I think my grandmother, my dad's mom, passed when I was maybe 12, maybe even less than that. And I didn't quite understand it. In fact, I didn't go to her funeral. We went over the hill to their house, and actually my grandfather on my mom's side stayed at the house with me because I couldn't quite process what her death meant, like what that looked like. I honestly, maybe I was like 8 years old, so maybe I should have known, but she didn't take very good care of herself. She had diabetes. I can't remember if she died from complications of diabetes or if it was a stroke based off of that. But so my grandfather stayed, and I mean, as terrible as it sounded, we stayed at the house and watched The Price is Right while everyone else went to the funeral because he didn't want me to be alone. Both my parents felt like they needed to be at the funeral. And so he chose to stay with me to help. And he talked to me about it. Like he was like, she's not coming home and things like that. And I was like, okay. I was like, but like, where did she go? You know, like those sort of things.
Existential questions.
People ask those questions. And I, as a kid, didn't get it. And I remember my sister being not upset about it, but she didn't understand why I couldn't figure it out. And then as we kind of grew, and then my great-grandmother passed, and we've had other deaths in the family, and I was like, okay, now it makes sense. Like as you age, you kind of understand it. But it's always difficult, and people always comprehend it differently than others. And so I think just being someone that can help explain what's happening, and again, the whole process of what dying looks like, and then what happens to the body when they leave here, and then the funeral
it's a natural
services
process
and things like that. I mean, we expect death basically from like 75 up. Sure. To be honest, having a young patient is anyone really under the age of 65.
Interesting.
And I mean, you don't think about it that way, and then we think of anyone under the age of 30 being like a kid. Right. I mean, they're younger than me. And so I'm like, I would always refer to them as kids. And so, but we, you know, for example, we'll get something coming in from the ER and it would be like, you know, myocardial infarction, a heart attack at the age of 49. And you just kind of really like, you're like, shit, you know, like for us that see that, we're typically, you would see patients getting heart attacks in their 70s, maybe even 80s. When you see it in a younger clientele, you're like, whoa. Like what? Like
Well,
there has
even,
to be
like,
something else.
Cancer and stuff. Like we have our friend who passed away at 40 from breast cancer, and that was, you know, pretty awful. And my friend's son who passed away, and I encouraged him to have his younger brother come to the viewing just so he could understand, also to be with the family, to understand this is a natural process. I know it's his brother and that has passed away, to give his last respect, so he didn't feel like he was isolated from it, but to also understand that this is a natural process, and unfortunately this happened too soon than it should have, but this is your chance to honor him and say goodbye to him, and to be with your family, and to support your father in this, you know, and he was kind of on the fence of whether the young child should be there, and I was just like, but is it not? It's a natural process for him to understand.
I feel like you'd be doing him a disservice later in his life to not be able to understand how that happens. Again, my husband, has never, to his knowledge, other than his grandfather, really have to go. We had one, no, actually I take that back. His grandmother on his mother's side passed right when we started to see each other. In fact, she was the reason why we met. Right. And I was the nurse that was taking care of her, and she was not doing well. And his mother introduced us, said, "Oh, I have a son your age," and then voila, and now we're here. And so when his grandmother passed, we felt really connected to that piece. Like she kind of served her purpose, was to bring us together, that sort of thing. And so at her funeral, I was kind of a hot mess, because I was very grateful for her bringing him into my life. Yeah. But at the same time, he was grieving differently, because he was like, I don't really know how to handle death.
That's my matriarch, and
he struggled with that piece, and he's only had 2 deaths in his family. Where it's like, I mean, I've had 2 deaths in the last 6 months, that have affected me, and so it's like just outside of work, not patients or anything like that. But and so for him, his understanding of how I deal with stuff is a little bit different, and it's kind of interesting. I look back at it, and he just kind of sits there and lets me have my meltdown. Right. And you know, like loving, supportive husband. And then he's just like, you know,
give me a hug.
Come on. And then he's like, there, and you know, it's like, because he's not had a lot of experience on how to comfort people when they're going through that, and he's like, I don't know how you do this every day. And I was like, I mean, somebody has to do it, right? Exactly. And I'm not saying that, again, we've talked about our friends who have done worse jobs, like the pediatric oncology and stuff like that. Like, wow, this is way different than that. But again, I feel like it's easier to handle when you know that these patients have lived lives. Right.
They're older, they're 98 years old. You're like, okay, my 92-year-old, was it rough for me? Did I cry obscenely? Yes. Was I distraught about it? Have I compartmentalized and have not dealt with it? Absolutely. But she was 92. She lived a full life. Yes. It was an amazing life. But when you have people who are younger, like our friend who passed away at 40, my friend's
no
son,
other health history or any other issue.
Wonderful husband, 2 young kids. Like,
fucking ruins everything.
Yeah, and you feel like this very sense of injustice from it.
Yeah.
And that sucks, because we then put that emotional attachment to it, where, you know, you can divorce that from that and just be like, this is how our meat pockets work, you know, and bad things happen. But you know, like for us who deal with it, it is still rough. Like when we personally deal with it, even we deal with it every day. You know, I try to be very comfortable with death. I enjoy death, not that I join death, but you know what I mean. It's not a difficult topic for me. Yeah. It's my job, and I'm a little gothic, and it's just kind of the thing that, you know, it doesn't
listen to stories about death and
doesn't frighten me. You know, I feel comfortable with it, whatever your beliefs are, wherever you go, however you feel about it. And it's still difficult, you know what I mean? Like, did I cry a lot at our friend's funeral? Absolutely. I did, you know, like, do I still want to cry about it? Absolutely. You know, like.
Well, and it's like, and then we have other friends who have had similar situations and they've made it. Like, what makes that person any better than the next person that didn't make it, you know? And I've heard some of our friends talk about that she's like, I had stage 3 or stage 4 cancer and I made it. Why didn't she?
Yeah, survivor's guilt and all that.
All
things
of
that go
those
into
things. It. Yeah, and same sort of deal. And we see that with families that come in through the unit.
Oh, geez.
And we were able to treat her, and she was able to walk out of here. And so her issue was that, you know, and she was a fairly healthy person. She had a stroke at a very young age. It was an odd case. I think she had some issues with cholesterol, so had like, you know, I don't know if like a piece of plaque popped off and then that's what caused her stroke. But young, healthy woman had no other real history and had this stroke, right? So we treat her, and she's very grateful, and she walks out of here, very minimal deficits, carries on with her life. 6 months later, her husband, super healthy, has no other real health history, comes in with this huge issue and dies. And she's literally like, why didn't I go first? Like, I was just here. And she's like, and now it's me making the decision. Like, at the time, it was him making a decision for her, and now it's her making a decision for him. And she's just like, why am I any better? And I'm like, that's really, I mean, I hear what you're saying, and that is awful that you unfortunately are thinking that way, but it's not, you can't control any of it.
Right.
So it was very interesting to hear her kind of say, like, it should have been me first.
Thank you for listening to this podcast. If you found value, please like, subscribe, and share. And be sure to follow me on all the socials at Sips and Tips with Lindsay. And of course, you can always go to my website, sipsandtipswithlindsay.com, to find more information about estate planning, business, snowboard, travel, and of course, wine. As always, we have to get the legal stuff out of the way. I went to law school, so you don't have to. However, we have to read the special disclaimer that I am not a practicing attorney. I am not your attorney. I am not offering any legal advice in any content or any episode. All content is for your information and educational purposes only. It is not a substitute for seeking your own legal advice from your own attorney or other professionals such as a CPA or financial advisor. I cannot give legal advice and do not offer any legal services or legal advice, but I do offer some fun and educational content for you to enjoy.